Microbiology Virtual University.
अदृष्टा विश्वदृष्टा प्रतिबुद्धा भूतन। ओम सर्वगुण संपन्न सनातन वैदिक हिंदू धर्म।
Globally glorifying the traditional Vedic knowledge system and culture.
हमारी जो नेक्स्ट टॉक है वो हमारा वीडियो हमारे ये स्टूडेंट हैं रशिया से। हाँ, रशिया से स्टूडेंट हैं। ये
confirmed by the positive dynamics of ultrasound data. A few words about hirudotherapy in Ayurveda. Most often, Ayurvedic bloodletting is performed not by instrumental device to a blood vessel, but with the help of hirudotherapy certain liquids. The main source of information on this issue is Sushruta Samhita. Russian masters and doctors have learned and practiced hirudotherapy. The only difference between Russian practice and Ayurvedic medicine is what types of leeches are used for bloodletting. In Russia, it is believed that three types of leeches are useful, and doctors guided by knowledge from Ayurveda now. Yes, were under observation. Disease. Intermittent blood flow disorder was diagnosed in all three study participants. Problem. The duration of the disease ranged from 3 to 7 years. The study did not include Dear colleagues and friends, I welcome you all to the World Vedic Conference. My name is Ksenia Alexandrovna Studenikina. This year I did some research on the topic the effectiveness of hirudotherapy in the treatment of blood flow disorders, pelvic organs in women. The results of a clinical study of the effectiveness of hirudotherapy in the treatment of pelvic blood flow disorders in women are presented. Under the influence of hirudotherapy, there is a rapid relief of pain syndromes, improvement of blood flow in the pelvic organs, and endometrial growth, which is confirmed by the positive dynamics of ultrasound data. A few words about hirudotherapy in Ayurveda. Most often, Ayurvedic bloodletting is performed not by instrumental damage to a blood vessel, but with the help of hirudotherapy certain leeches. The main source of information on this issue is Sushruta Samhita. Russian masters and doctors have learned, known, and practiced hirudotherapy. The only difference between Russian practice and Ayurvedic medicine is what types of leeches are used for bloodletting. In Russia, it is believed that three types of leeches are useful, and doctors guided by knowledge from Ayurveda know 6 types of leeches that can help a person restore health. One of the authors of Ayurveda, Sushruta Samhita, writes that he knows 12 types of leeches, half of which are harmful to humans and can cause a small disease, and the bite of an individual of one of the species is even fatal. For disease-free women with habitual miscarriage and infertility aged from 20-40 to 30-60 years were under observation. Disease. Endometrial blood flow disorder was diagnosed in all three study participants. Problem. The duration of the disease ranged from 3 to 7 years. The study did not include patients with acute and specific inflammation. Time 3 to 4 months after the end of the course of treatment, ultrasound of the internal genitalia was repeated. Results. After the course of treatment, women who received hirudotherapy had a significant positive dynamics of the echographic picture. The results obtained give grounds to believe that hirudotherapy is an effective method of treating infertility and habitual miscarriage, which can be recommended as a necessary part of the complex therapy of this pathology. The graph shows that the result has been achieved 100 for absolutely all problems. 100% complaints of moderate of severe pain, 100% possible adhesive changes, and 100% violation of blood. After the course of treatment, women who received hirudotherapy had a significant positive dynamics of the echographic picture. Thus, a violation of blood flow was not registered in any participant of the study, which is confirmed by the diagnostic protocol of ultrasound examination. Thus, the inclusion of hirudotherapy in the complex treatment of habitual miscarriage and disorders of the blood flow of the pelvic organs provides repeat regression and relief of chronic pain syndrome. The results obtained give grounds to believe that hirudotherapy is an effective method of treating infertility and habitual miscarriage, which can be recommended as a necessary part of the complex therapy of this pathology. The report is over. Thanks for your attention.
Vedic Microbiology Virtual University.